Welcome to Public Health Matters, where we talk about matters in public health. My name is Lisa Vasquez, and will be covering for Jane Goodman today as she is away. And as always, we'll start with a COVID-19 case update. Globally, we have 57 million cases and 1.36 million deaths. In the U.S., we're seeing 11.7 million cases and 252,000 deaths. In New Hampshire, cases have reached 16,277, with deaths reaching 506. Currently, our case count is 4,006. Our recovery rate statewide is 86%, and currently hospitalizations are at 98, and that's total count, so 98 people. Case fatality rate is about 3%, and the positivity rate for the state is 4.1%. In Nashua, our cumulative cases have reached 1,701. Active cases are 413. We have 434 contacts. The average new cases per day is 35. The hospitalization rate for Nashua is 5.4%, and deaths have reached 40, and that's 40 actual people, not a percentage. And the recovery rate for Nashua is 75%. Case fatality rate is 2.3% in Nashua. The level of transmission is considered substantial in Nashua. The new cases per 1,000 over the last 14 days is 498. The new hospitalizations per 100,000 over the last 14 days is 5.6, and our 7-day PCR test positivity rate is 9%. Both Nashua and the state of New Hampshire have seen increases in the average number of new cases per day per week since the beginning of September. Nashua had gotten down to less than 1 new case per day at the end of August, and now is at 10 new cases per day on average for the past week, November 2nd to November 8th. When we look at the age group of under 19 years old, we see that the 15 to 19-year-olds are leading in cases. How can we slow the spread of COVID-19? The first thing is stay home if you are feeling ill. So if you are sick, stay home except to seek medical attention. Wear a mask when in stores, offices, and other public places, like restaurants, houses of worship, and businesses. Avoid large and even small gatherings indoors. And keep a distance of 6 feet from those not in your immediate family. COVID testing is available on Saturday, November 21st from 9 a.m. to 12 a.m. at Harbor Care. This is an by appointment clinic, so please give them a call at 603-821-7788. They do take insurance and have a sliding scale. Please call and inquire about making an appointment. On Monday, November 23rd, the Division of Public Health will have its clinic from 10 a.m. to 12 p.m. at Elm Street Parking Garage. This is also by appointment, and you can make an appointment either by calling 603-589-3456 or go to our website at www.nashuanh.gov. If you have any questions, you can always email me, vasquezl@nashuanh.gov, or like I said earlier, reach out to our website, www.nashuanh.gov, for more information. Welcome to Public Health Matters, where we talk about matters in public health. I'm your host for today, Lisa Vasquez, covering for Jane Goodman, who's away. And today I have Lisa Gingras here from the athletic director for the Nashua School District. welcome so much. We're going to take off our masks because we are 6 feet apart, so we are still social distancing. Can you just, Lisa, tell me really quick what your primary responsibility as an athletic director is like?
So as athletic director of the Nashua Public Schools, I am in charge of and oversee all of the athletic programs, the interscholastic athletic programs in our 2 high schools and 3 middle schools.
That sounds like a big responsibility.
It is a big responsibility.
How many children does that cover?
Well, we have 1,800 kids in each high school and comparable in the middle schools, but we have about 1,000 high school athletes each year, and probably a little more than that, maybe 1,200 in the middle schools each year.
Wow. What do you think is the value of athletics in the schools? What is the value of athletics in a student's school life?
I could talk about this for an hour or more. I really believe that although voluntary, participating in interscholastic athletics is really critical to some of our students. It is the best experience they have in their high school careers. Even in our middle school programs, a lot of students have an opportunity to be involved in something that's bigger than themselves. It's not just going to school, doing their homework, and participating in a variety of outside of school activities, but it's really an opportunity for them to show that pride and put on that school uniform. You know, I'm an Elm Street Eagle or a Pennachuck Raider or a Fairgrounds Falcon or a Titan or a Panther, that they put on that school uniform and they have that pride. Interscholastic athletics is really some of the most influential and impactful social emotional learning that our kids learn. They learn responsibility, they learn advocating for themselves, they learn accountability to other people other than themselves. I could go on talking about this part for a long time, in being part of something and knowing that you've contributed, whether it's in a small way or in a really big way, to a program that moves forward is really important for our students.
I can imagine it builds a lot of skills that the kids take with them throughout their whole life.
Yes.
I can say that today we were doing an interview and one of the questions was, how do you work in a team? So kids will take that and bring that to their job in their future, how they work well in a team and how they, how they get through adversity or losing something and kind of moving past that. So I think those are all skills that they can just take with them forever.
Absolutely. They learn those life skills that are taught in a variety of different ways, whether you're in the band or the chorus or student government or any of those other activities. All of the co-curricular activities in our high schools and middle schools are very important for our students.
How has the pandemic shaped your role as athletic director?
Oh, goodness. So starting in March, it was unbelievable when we got that phone call that the winter tournaments had stopped. Most of our teams had completed their winter seasons other than our boys basketball programs. So at that point in time, telling those kids who have worked so hard and had won their last game, but it wasn't the championship they had just won, knowing that they were moving on to the next phase and for it all to have been canceled was really hard to talk to those kids. Probably one of the biggest things that happened out of the pandemic in the world of athletic directors is we learned to rely on each other even more. I was on divisional calls, meetings, Zoom meetings every single week. I was on state level meetings every week and even got involved in several national level meetings every week because all across the country, all across the world, we were all dealing with the same thing. So it was interesting to talk about what were they doing in California and Georgia and even Alaska relative to the pandemic with their different sports and, whose sports were being canceled, who was still moving forward, who was moving sports to the summer. So that really transformed and opened up quite a bit for all of us starting in March. And then when we got word that the spring season had been canceled, that was devastating for our students, especially for our seniors who were going to lose their last season in high school and that last season for our 8th graders in our middle schools. So it was a matter of figuring out how do we recognize those students and reward those students for the 11 seasons prior to that where they have worked so hard. So we did a lot in the spring trying to recognize our students. We had a Light Up the Night event at both Holman Stadium and Stello Stadium, where we put 20s, as many 20s as we could on the scoreboards, put on all the stadium lights, because the lights hadn't been on for several months because sports had been canceled. We went around, we did our regular end of this year awards, our Scholar Athlete Awards, our Athlete of the Year Awards, things like that, our 12 season awards. And we had a little parade, and we drove around the city to, I don't even remember how many students, it was well over 50 of our high school seniors, to present them with that small little token. So I think those were the biggest things to, as we were just talking about, athletics does so much for our students that when it was just ripped away from them, it was really difficult, and we were trying to give them little pieces of it back.
Thank you. Who did you call upon to help you make decisions about fall sports?
So that was, as I talked about, everybody in our division, in our state, across the country. We networked, we talked with them. My team here in Nashua, I have athletic coordinators and secretaries and coaches, worked with you guys at public health periodically, the school board, the superintendent's office. Like, it was not just, me sitting in a silo making all the decisions ourselves. It was very unusual not to think about the fact that we were going to or not going to have fall sports. It was this very unusual, unsettling feeling. Then our state association, the NHIAA, delayed the start of the season, sort of let schools open up in whatever form or fashion that was going to be, and then let us start our athletic programs. So working with the state, working with our athletic trainers, working with the sports medicine committee, working with the health department, working with the school board, working with our coaches and our students and our parents on how do we do this safely. So there were a lot of people involved in a lot of the decisions that were made getting fall off.
I know you have been working with the health department. How do you believe this relationship has helped your efforts in keeping the sports activities safe throughout the fall season?
That's a great question. In fact, I had a call with Bobby a little bit ago, Bobby Bagley, and just, I think, having that open line of communication where if I have a question about something, I have no problem emailing the department or calling Bobby or reaching out in any means to get those questions answered. Likewise, Bobby actually called me today with questions about, hey, I heard something, can you answer this for me? And we were able to clear that up. So I think it's really important, and having that open line of communication is so important right now, because even a month ago, numbers in the situation we were living in were very, very different. At that point in time, middle of October, Manchester and Nashua were the only red part of the state of New Hampshire, and now every part of our state is red. So being able to navigate through that and understand that, and that really helped this fall when some of our teams needed to have either games canceled or postponed because of what was going on either in our community or other communities. It was much easier to get direct information and be able to share that with our students, our coaches, and our families, that it didn't present that fear that, oh, is there a positive case on our team? Nope, we need to investigate something, we need to move forward, we need to figure out, do any of our students need to be quarantined because they were exposed? So before they expose anybody else, let's put a pause on this so we don't have to cancel if we continue right now. So that relationship is very important. We met a couple of times leading up to making any decisions about winter and looking at what are our protocols look like, what do they need to look like, what do we need to add, things like that.
Who else do you collaborate with to make these important decisions?
We talked about that, everybody. Other ADs, we are on weekly, if not a couple of times a week calls, talking to our local communities, talking to Hudson, talking to Merrimack, talking to Hollis, the Manchester schools, things like that. Everybody who we would normally play in a season. And we're working together so that it's very consistent, so that if someone comes into our gym, they know what to expect and they know how safe they're going to be, as well as if our students go into somebody else's gym, we know similar, if not exact same protocols are being followed.
Awesome. Lisa, we have seen substantial cases in the state and in Nashua, and that has resulted in changes from focusing on containment to mitigation. What are your thoughts on the impact of these increases in cases on winter sports?
That's a $1 million question. I wish I had a crystal ball that could look into December and January and see what it is. Obviously, there's a lot more concern, and I'll even use the word fear about winter sports because all but one of them are inside. Everything is in a building, in a school building, and not outside in a large stadium in the fresh air or out on one of our fields. So that's a hard question. And some of it is we're doing everything that we can. We as a community of athletic directors who are going to compete against each other, hopefully this winter, have made decisions about sports that will wear masks during competition. I know yesterday the governor put out a statewide mandate on masks, but there is an exception for schools as well as for those engaging in strenuous activity. So that would remove our students from having to wear them in competition. But we have voted and agreed to that in basketball and ice hockey, all of our students are wearing masks even during competition because we know there's a lot of pretty close contact in those sports. So we're doing what we can do to also help mitigate the spread.
What has been the biggest challenge that you've faced over the past few months?
Probably things changing by the minute. I think that's probably one of the biggest challenges. And I know there's a lot of people out there because of the changes and because of the fear and because of the concerns who are also struggling with their mental health. And I think that's probably a bigger thing. We're concerned about our students. We're concerned about our colleagues. We're concerned about our coaches and our students' parents and everybody in that regard. So I think it's been a challenge to navigate the waters of our students playing safely, but also the community perception of if you see one thing, that doesn't mean we're not following the rules. So there's been a lot of challenges this fall, for sure. We've definitely, as a group of athletic directors, as a group of teachers, as a group of coaches, principals, everybody in school systems have worked very hard to do what's right and what's best for our students.
What do you think are going to be the biggest challenges moving forward?
Moving forward into winter, I think the biggest challenges of the numbers are continuing to go up. I'm confident they're going to continue to go up after the Thanksgiving holiday because people are going to get together after the Christmas and the Hanukkah holidays. People are going to gather in groups that, rightfully so, a lot of us haven't seen our families in such a long time in a close-knit environment. So I think those challenges and what's the breaking point? When the numbers get to a certain level, at what point, do schools shut down completely again and go 100% remote at a much grander level than they are now? I know a lot of my colleagues, schools are closing from Thanksgiving to the middle of January because of the travel and trying to avoid those spikes coming into the schools. I think indoor sports, we still at this point have not received approval from our school board to move forward with winter sports. I'm hoping that will come in the next couple of weeks before we could potentially start our season in the middle of December. So there's a lot of challenges. It's challenging to navigate the school system as well as the athletic programs, and at the same time keep myself and my family safe. So I think we're all kind of in the same position where that's concerned.
And especially when you were saying earlier, everything's changing like minute by minute. So it's really hard to keep up when things are changing so rapidly.
Yes.
What do you do for your own self-care?
Oh gosh, I'll be honest. I'm a workaholic, so my self-care probably is low on the priority list. But I do have good friends that we go for walks, we go for hikes out in Mine Falls. I probably have been in Mine Falls and walking around downtown more in the past 6 months than I have in all my years in Nashua. So I like to get outside, spend time with my dog, and definitely eat a lot of pizza.
What should other student athletes do for their own self-care?
It's a good question. I think one of the biggest things is whether or not we are allowed to come together and play our organized interscholastic sports. Everybody needs to move somehow, some way. Get outside, get fresh air. Today is a beautiful day. The sun's shining. Go out, You know, even if it's a little chilly, if it's cold, if it's drizzly, go outside and just breathe some fresh air. I think that's important. I think it's also important, especially for our students who right now are doing remote learning, and if they're in the hybrid mode, they're still remote some of the time. So I think it's important that get off your screens, get off computers, get away from televisions, get away from cell phones, get off screens and have a conversation like we're doing now, and spend some quality time, social distance, of course, but spend some time with some people that you haven't seen in a while. I think that's important. I think eating healthy is also important. You know, the typical things, drink a lot of water and things like that, that just keep yourself at the top priority.
Awesome. Are you aware of the school dashboard that the state has on the website? How have you used this information in your decision making when games were played or not played?
I am very aware of that. I look at that probably 10 times a day. I don't know why, because I don't think it's updated during the day. I think it's just updated once a day. But we do look at that. There are some of our schools that are not allowed to play any school that has any positive cases. So I look at that. If I know we're going to play an opponent, I look to see if they have any current active cases. And then I call that athletic director and, you know, what do you know about this case and what can you tell me? Is it any one of your athletes? Is that person in school? Have they had potential exposure to your athletes that we're going to play tomorrow? So we have those conversations. And yes, that has come into play a couple of times in conversations that I've had with Bobby. And we look at that and we talk about those cases and we make those decisions to either postpone or cancel a game.
What are your thoughts about the new mask ordinance just announced by the governor yesterday at his press conference?
I don't feel it really affects us because we've had one in Nashua for so long that everybody's just used to it at this point. The one thing I think that is good from it is, although we want to keep people close and not travel too far, you can go to a neighboring town and know that the same rules that we've been living under in Nashua are going to be upheld in Hudson or Merrimack or Manchester or Amherst, any of the local communities. So I think that's helpful. When it first came out, we were a little, how does this affect us for sports? But as I said before, we've already put in mandates for masks in the closest sports of basketball and ice hockey. We are having discussions about some of our other winter sports that we're hoping to play. Obviously, you can't wear a mask when you're swimming in a pool. That's not going to work. Gymnastics is a little worrisome because they need their peripheral vision and looking down and things like that. So we're talking about each individual sport and the safety of it and weighing out which is the more risk, not wearing the mask or wearing the mask because it's going to cause another safety issue in that sport. So
I just don't know how, like, it's a lot that you have to do. You have to take a lot of information in, talk about a lot to community partners, think about so many kids in the school, and it impacts the community at large. People go to games and, you know, they root for their kids, they root for their schools. How much do you think it, like, impacts you personally, like making the decisions? How much, I know you don't take these decisions lightly,
No.
but like, is it impacting you?
It is impacting me because, again, there's a struggle with this is what's good for kids, but simultaneously, as long as they follow all the rules and do everything correctly. You know, we had a lot of students this fall when we made the decision and were approved to play outdoor sports, play our fall sports, where some of our students made the decision on their own. I'll use soccer, for example. I'm not going to spend any time with anybody other than my soccer team and my family. They kind of created their own little bubble and circle of people that they interacted with. So that was actually a very prideful moment for me that our students were taking this so seriously. I think a lot of our students and parents are grateful that they were able to get back to something that was normal. For so long, for March, when have we ever shut down schools other than a snow day or a vacation? You know, when has it been a statewide mandate that we can't go into a school building and now all of a sudden you have a week to figure out remote learning? So I think it's been such unprecedented times that I'm a person who wants to be part of the solution. You'll never hear me complain about something without also, what if we try this to solve that? So being someone who I not only have responsibilities with the athletic department, but I'm also part of the school administrative teams. I'm part of the district office administrative team. So although my title is director of athletics, I kind of have my fingers in a lot of other things that people don't realize. And I like to be able to offer something that might help us get through this and get onto the other side.
Awesome. What are your plans for Thanksgiving?
I am going to my parents for Thanksgiving. They live in Litchfield, so just the three of us. Small little dinner, social distanced, because I haven't really seen them, you know, because they're older. So I've been doing my best. I'm at work every day. I'm with the kids. I keep my distance. I wear my mask, but I'm still out with people. So I'm doing my best to protect them as well.
Awesome. I'm really happy to hear that you're doing a lot for your own self-care. I love pizza as well, so I get that. And the walking is so good. Can you give some recommendations for like smaller children? I know you said for like kids to, you know, try to do some outdoorsy things, but what can people or parents do with their smaller children?
Even with the younger children, I think, again, the biggest advice, get them off the screens. You know, I know it's difficult for our working parents, whether they're working out of the home or they're working remotely from home. They need to do their work. So sometimes it's a lot easier just, you know, here's an iPad, here's a cell phone, you know, watch this movie, something like that. I think the biggest thing is to get away from that screen time, to really look and focus and have that family dinner, you know, sit and play a game, do a puzzle, do something like that, and go for walks. Even if it's around the block, even if it's around your house, even with the young kids, you know, really young students, put them in a stroller, put them in a wagon. When I go for walks with my dogs, I have a buggy. She's in a little stroller. Sometimes people come around and they're like, oh my God, I thought that was a child, but nope, it's my dog. So things like that. And I just think it's a matter of reconnecting with people. Pick up the phone and call somebody rather than FaceTiming or Zooming with them, you know, just to kind of give our brains and our eyes a rest from that.
Yeah, or even write, you know, a letter.
Yes.
Ooh.
Yeah. Old school pen pals.
Oh, yeah. Go way back.
Yeah, exactly.
Is there anything you would like people to know about you or the school district or sports or anything?
I would just say to the community out there that if your child has not been involved in our interscholastic sports in the middle or high school, try it. Whether it's this winter we get approved, whether it's in the spring, or whether it's sometime next year, give our programs a try. We have 16 different athletic programs in our middle schools, and we have 32 different varsity sports in our high school programs in both of our high schools. So give them a try. If you realize sports isn't for you, like I said earlier, get involved in the band, the chorus, the drama, student government, get involved in something. I know at our elementary schools, there's things like Destination Imagination or our cross-country programs for our upper elementary students, things like that. So there's definitely things out there to be involved. I think it's important for our students to be involved in their school other than showing up, going to classes, going home, doing their homework, to engage with students and other faculty in the schools outside of just their academics.
Definitely feel part of,
Yes.
you know, the school community and make sure that not only are you seen, you're valued and you're giving something back
Yes.
to your school community.
Absolutely.
Thank you so much, Lisa, for being here with us today. We're so thankful for all you do, not just for the school district, but for all our kids and our community at large. I know that you work really hard to make sure that all our kids are safe, and we thank you for that.
Well, thank you very much for having me today.
Thank you so much for being with us here today at Public Health Matters, and we'll see you soon.